Hello, my name's Ron and I live in North Carolina. I've done a lot of research on healthcare reform and I hopefully can end some of the confusion around the costs, what we're paying today and what needs to get fixed in this. I've lived under both the Canadian and the US healthcare system, and I want to say first off that the scare tactics that you've heard about the Canadian healthcare system and how the level of care is just substandard is incorrect, and I'll show you a couple of statistics on that later in this. According to the Department of Health and Human Services, healthcare will cost us $8,000 per person this year. That's per person, not per family. And that is an average cost. So if you've got a fairly healthy family, you're not going to see a cost of $8,000. But know that on average, that's what it's costing per person per year. Now, if we look at what that is as a portion of our GDP, in 2007 it was 16.2%. And in 2018, they're expecting it to be as high as 20.3%. In comparison, Canada's current portion of GDP that they spend on healthcare is 10.3%. We spend, in 2008, $650 billion more than what we would pay on average as an OECD nation. So are we really getting more for our money? Many will tell you that. But if we look at what the infant mortality rate and the life expectancy of our people is, it doesn't show that. In the United States, we have 6.4 deaths per 1,000 live births, and 78 is the average age that both men and women live to. Canada has a 4.6 deaths per 1,000 with a life expectancy of 80.3%. Gallup in 2003 did a study of both US citizens and Canadian citizens and asked them two questions. Are you satisfied with the availability of affordable health care? And are you satisfied with the quality of medical care? Interesting in these facts, twice the number of Canadians are satisfied with their access to affordable health care, but almost identical numbers were satisfied with the quality of the care. So Canadians do not feel that they are getting substandard health care, but they certainly feel that they have better access to it. In 2003, the New England Journal of Medicine looked at what Americans spent and what Canadians spent on administration costs. And they collected a great deal of information on this, and that's why there's not a lot of studies on this. It's very difficult to collect all this. What they found was that Americans spent more than 3 times as much per capita on administrative costs. In 1999, it was $1,059 per capita on administrative costs of healthcare, whereas Canadians spent only $307. Now, if we compare that between Medicare and private insurance, which is our closest comparison we can make here in the US, it's amazing. The numbers are identical, 3 times as much. And I took the numbers for Medicare administrative costs from a conservative organization, Council for Affordable Health Insurance, who advocate against public insurance. So there's a lot of different numbers for Medicare administrative costs, but I took this from a very conservative group, and it's still less than a third of the cost of what private administrative costs are. Now, many people say it's so expensive to change the system. Can't we just leave it the same? Look at where the costs are going to go as a portion of our GDP. Medicare and Medicaid are going to absorb a much greater portion of this unless we find change now. So where are the real problems? 47 million people, 15.8% of the population, have no health insurance. 11.7% of the children have no health insurance. And 25 million US citizens are underinsured. That's up 60% from 2003. 62% of all personal bankruptcies in the US in 2007 were caused by health insurance problems, or health problems, 78% of those filers had insurance. Most of those who filed were middle-class citizens. 67% owned their homes, 60% had gone to college. These people did not expect to have health insurance take them under. Underinsurance is a great hidden risk of the American healthcare system. People do not realize they are one diagnosis away from financial collapse. Many more are probably underinsured and just don't realize it. Many healthcare insurers provide limited benefit policies that simply provide a cheaper alternative that gives peace of mind. But if you really need the benefits, they won't be there in an adequate amount to cover your requirements. And that's where a lot of these personal bankruptcies come from. People pay what they can afford and get the insurance coverage that they feel they can afford. But just peace of mind does not give you insurance. True peace of mind for a lot of people with pre-existing conditions only comes from high-risk insurance pools that are substantially subsidized by state governments right now. Only 34 states have active pools, and premiums for people with pre-existing conditions usually cost over $1,000 a month. That dramatically changes the standard of their living because many of these people are getting this later in life. Health insurance providers say they cannot offer the coverage to those with pre-existing conditions because the costs and risks cannot be spread over a large enough pool of people without universal coverage. A lot are asking, why does the government need to get involved to solve the problem? If you look at insurance companies, they have a responsibility to their shareholders to maximize profit and minimize risk. There are three things in that are very telling of where the private insurance needs direction. The only way that people with pre-existing conditions will get affordable coverage is if it is mandated, because pre-existing conditions reduce profit and increase risk. Low-income earners can rarely afford the premiums that are needed on a policy that provides them with adequate coverage. And we must accept the fact that there will be some redistribution. And we also need to ensure that we have rules and regulations to ensure that people, number one, understand their policies, and number two, have adequate coverage. Do we need a public option? The answer simply is no, we do not. But we do need to keep in mind that whatever we do has to put pressure on the private insurers to reduce their administrative costs and to improve their coverage. And a public option has definite advantages. In all of this, we have to remember that Medicare has far lower administrative costs. We looked at that, 5.2% compared to 16.7%. We also have to remember that we paid $650 billion in 2008, more than other industrialized nations would have paid. And the other thing we have to remember is that the private system today, as it is, leaves 47 million uninsured and another 25 million underinsured. How do I, as a person, make a difference? Well, the biggest way is call, email, or write both of your senators today, because that's where legislation will be hardest to pass. So that's where you can make a difference. You can influence their vote. You can also influence your congressman's vote. If you don't know your senator's name, go to www.senate.gov. You need to tell them three things in detail. You need to tell them you want affordable health coverage for everyone, you want coverage for people with pre-existing conditions, and you want rules and regulations in place that guarantee adequate coverage and policy transparency. And don't underestimate your power. Tell your senator and your congressman that your vote for them depends on their vote for health care. Thank you.